3 years after the first case of COVID-19 was reported in Wuhan, China, a classified report from the Department of Energy in Washington has concluded the virus most likely came from a laboratory leak in China. However, no one involved is saying that finding is definite. Tarek is here now to show us how this new report came about and what a local doctor says is really most important for all of us to keep in mind. Tarek?
Well, authorities familiar with the Energy Department's report say it was a low-confidence intelligence assessment, meaning that the information that was obtained by the government is not reliable enough to make a definitive judgment as to whether or not COVID escaped a laboratory or if it originated in the wild in China. We spoke with a local doctor who says the origin of COVID-19 shouldn't be the most important thing for those who are at risk. U.S. intelligence officials remain divided on the origin of COVID-19, a virus responsible for the deaths of more than 7 million people over 3 years across the globe. On the heels of the Energy Department's low-confidence assessment that the virus escaped a Wuhan, China lab, U.S. officials are still digging for answers in hopes of strengthening the global response in the future.
We need to find out exactly how the coronavirus, the COVID virus, hit the world. If it came from an animal, we need to be prepared, and we need to beef up our public health response.
U.S. intelligence officials have been split on the issue for years. A report from 2021 found that 4 agencies in the U.S. intelligence community had assessed with low confidence that the virus jumped from animals to humans in the wild. But that report said a 5th agency in the intelligence community had moderate confidence that the pandemic was the result of a laboratory accident. Scientists say that uncovering the origin of COVID-19 can help prevent the next global pandemic. But local infectious disease specialist Dr. Mohammed Reza says the origin's not as critical to the general public, who he urges to still take the necessary precautions.
I don't know if it matters because regardless, it's a virus.
Reza says what is important for the general public now is taking the steps to protect against infection and death.
And using those tools available to us now that we have, that we didn't a couple of years ago, the vaccine first and foremost, the antivirals as well, those will help us. If you are infected with this virus, now we have those things that we can take to protect us to not have that severe outcome.
U.S. officials are saying now if they can definitively prove that COVID-19 was created in a laboratory, they intend on holding China accountable. Some senators are calling for public hearings following the Department of Energy's assessment that was released. Mary?